Alright, so we're going to continue with radiohumeral mobilization. Again, if the patient's having difficulty with flexion and extension, we're dealing with a radial head, we're dealing with the concavity that's on a convex surface of the humerus. So in order to help flexion, if I have a problem directly at this joint system, I'm also going to do a ventral glide for flexion and a dorsal glide for extension to help enhance that. I'm going to get the patient in position. I'm going to check that first pronate the forearm to its full extent and supinate to its full extent and find where neutral forearm position is. Move them into about 35 degrees of supination. At this point, my proximal hand and thumb is going to be on the joint line, and I'm going to stabilize the humerus with my proximal hand. My caudal hand is on the radial head, and I'm going to do a ventral glide of the radius on humerus. From this position, I'm just pressing in with my thumb into a ventral direction, fingers pointing the direction it's going in. I will reset, stabilize humerus. Now I'm going to do a dorsal or posterior glide. Take up the slack, take the soft tissue up. I'm only holding on to the radius and only holding on to the radial bone, and I'm going to do a dorsal glide. So this is radial humeral ventral posterior glide.